today's modern world, man, it's hard to get away from inflammatory, causes. You know, whether that's a fatty diet. Like for lunch, I went and had a fillet of fish. It's Friday. I don't know. I just had to get something quick, right? Like that's gonna be terrible. That's ugh. But it's just in today's modern quick world, I had to find something. Um, no one's drinking enough water. People are drinking soda. There's so much sugar. Sugar is hugely pro-inflammatory. I had a couple products that I created that the goal of the product was to create something with no sugar because sugar is so pro-inflammatory. You look at your cell phones. Your cell phones. You're in front of your phone all the time. You blink substantially less when you're in front of your phone, and it's the blink that's pumping all these wonderful oils from our meibomian glands onto the ocular surface, and that protects the tear film underneath it from evaporating, and then when those tears are gone, inflammation occurs. So the technology with us blinking less is causing a whole bunch of issues. I don't know if you can get away from inflammation. I think your best courses of action um, are to limit screen time. So, of course, the 20-20-20 rule, there's definitely something to that. Every 20 minutes, look at something 20 feet away for at least 20 seconds and give yourself a couple really good blinks. Using a great artificial tear like your Retain. Retain's a great drop. It's predominantly oil. So you use that, boom, boom, and that's going to help prevent the tears from evaporating off. Warm compresses, just a mask that you throw in the microwave a couple nights a week. You heat that thing up, close your eyes, you wear it for 8 to 10 minutes. You take this thing off. I always tell my patients, hey, when you take that mask off, if your vision's a little blurry, that's a good thing. That's all the oils making their way out. Um, Again, when the oils don't get pumped out, the that oil just sits there, super nutrient dense. It's a warm, moist environment. Bacteria love that.
Yeah.
Bacteria cause inflammation. So, you've got the great OcuSoft scrubs and the foaming sprays and all this. To answer your question, I really don't know if it's possible in the modern world to avoid this inflammation. I think all we can do is just do our best to make it have the least amount of impact on our ocular comfort. And thankfully, there's a lot of great companies like y'all that are out there innovating and creating things that make our patients' lives easier.